I'm Dr. John. Welcome back to the office. Today we're going to talk about the causes of stenosis in the spine. We said before that stenosis is the narrowing of the opens of the spine, and it could happen at the central canal, which is central canal stenosis. It can happen at the neural foramina, which is neuroforaminal stenosis, and it could happen at the lateral recess, which is the lateral recess stenosis. And we said stenosis is the narrowing and the occluding of these openings that puts pressure on the spinal cord and the spinal structures that creates pain. And we also just said that 90% of the people in America will develop stenosis that are age 50 and over. So it is quite common, and symptoms could be mild to very severe. So the first cause of spinal stenosis, which is the most common, is what's called disc displacement. That's the protruded, the bulging, the herniated, or the extruded discs. And basically that is that. You can see that the disc is bulging. And when that disc starts to bulge and protrude, it's an injury, and it puts pressure on the neural foramina, the lateral recess, and the spinal canal, okay? That's one of the most common reasons of stenosis. The second most common reason of stenosis is disc degeneration. Now, I did want to point out that, which I pointed out in the first video, is that the disc is a really important structure. And the reason being is because it keeps space between the vertebrae. So once it loses integrity, like I showed you before, between a bulge like that, or if the disc desiccates or dehydrates, it will create stenosis because it'll put pressure on the opening. So we looked at the displaced disc. Now we're going to look at the dehydrated disc, which is also known as desiccated, and it's also called degenerated disc disease. So here you can see that this disc, you could barely see. It has desiccated or dehydrated. It should look more like this. You can see the thickness in the structure here, and you can see that the openings of the spine, the neural foramina, the lateral recess, and the central canal are open. That's because the disc is performing its function of maintaining the space between the vertebrae. Here we have a dehydrated or desiccated disc, and you can see once the disc loses its integrity to maintain space between the vertebrae, it starts putting pressure on the nerves at the neural foramina, it puts pressure on the lateral recess, and it occludes the opening of the central canal, creating stenosis. This formation is called a disc osteophytic formation, where the disc is dehydrated, which is part of the degenerated disc disease, and then it lays down these bone formations to protect the joint. That's called osteophytes, and this complex is called a osteophytic disc complex, and the osteophytes are part of degenerated joint disease. Now, these osteophytes that develop because of the wear and tear in the joint can put pressure and occlude the openings of the spine, creating stenosis. Another thing that happens with stenosis is something called posterior facet syndrome, where these posterior facets of the joint start to create, because the disc lost its integrity and is decreased, these bones or these joint facets can no longer perform its function, and they rub on each other, and as a fact from rubbing each other, from wear and tear, it creates what's called hypertrophy or posterior facet syndrome. And hypertrophy means that the wear and tear of the facet joints thicken the facet joints and occlude the openings of the spine. So the most three common ways stenosis occurs in the spine is, like we said, disc displacements, the bulging, the herniated, the protruded, the extruded disc. Degenerated disc, because the disc loses its integrity to maintain the spaces between the openings in the spine. And also degenerated joint disease, where the osteophytes form and the posterior facet syndrome happens. So when the disc loses its integrity, the facets rub on each other, and the facet joints also has a joint capsule, which is soft tissue, and that soft tissue occludes the opening and creates stenosis. Another way stenosis happens is something called ligament flavum hypertrophy. So the ligament flavum is a ligament that goes through the spinal cord and maintains integrity and stability for the spine. Now, through the wear and tear of the spine, the ligament flavum, there's a lot of pressure on it and it can't repair. And what happens is the ligament flavum becomes what's called hypertrophy, which means it thickens. And when it thickens, because it can't repairs, that thickness in the spinal cord, because it's located within the spinal canal, will get in the openings of the spine and create stenosis. Another way stenosis can happen in the spine is from spinal surgeries. Spinal surgeries will create scar tissue, also called fibrosis, that will occlude the openings of the spine and create stenosis. Other ways stenosis can happen, we see sometimes at our office, is through cysts in the spine and through spinal tumors. I'm Dr. John with 𝐤𝐧𝐸 Physical Medicine. It's a pleasure. I'll see you in the next video.